Magandang araw po sa ating lahat. Magandang araw mga cadets and cadets. So, narito na naman po tayo para sa panibagong topic sa ating klase. So, ang topic natin for today is about the basic life support. Okay, so ano nga ba ang kahalagahan ng basic life support? Bakit kailangan natin itong pag-aralan? Okay, before that, I am Sergeant Christine Joy A. Karcha, Philippine Army Reserve, PG-T11-000221. I am from Maldan, Pangasinan, and in the year 2011, enlist ako sa Reserve Force, Philippine Army, and then in the year 2014, napag-isip-isip, pag-enroll ako ng ROTC, at natapos ko ito ng 2014. Then, at the year 2015, up to today, ako ay graduate military assistant ng University of Luzon ROTC unit in Dagupan City. Okay, before we start our discussion, let's have some house rules. Okay, number one, you need to pay attention sa ating topic kasi napakahalaga nito, napaka-importante, at dapat alam natin kung ano yung gagawin natin in terms of emergency. Alright. Number two, avoid using mobile phone during class discussion. And three, you take down notes for assessment and evaluation mamaya after ng ating discussion. Okay, so ano nga ba yung mga objectives natin? So that letter A, to acquaint the students on the different medical terms that is strange to them. Then to understand the importance of the subject and the basic life-saving steps. And then to be able to apply first aid to the different cases encountered. Okay, so ito yung mga terms naman na ma-encounter ninyo during the discussion. So first aid serves as a bridge between the victim and the doctor or the medical facility for survival. Next is self-aid. This is a care for oneself. And the first aid naman is a person who give first aid. Then CPR, a life-saving technique useful in many emergencies. Okay, so ano nga ba ang first aid or in Tagalog, pangunang lunas? Okay, first aid is the management of a sudden illness or injury provided before the emergency services arrive to provide professional medical care. It is also called as training for life. And remember that first aid is not a treatment. It is it is to manage a situation. So, meron tayong tatlong principles sa first aid. Number one, preserve life to maintain the safety and well-being of all those involved in an emergency. Second, provide deterioration. You carry out a patient assessment and treatment with care. And the last one is to promote recovery. So arrange for medical care and provide first aid in accordance with the training and skills. So ano nga ba ang aim or purpose ng first aid? Number one is to save life, to relieve pain, to promote quick recovery, to prevent further injuries and infections, to control bleeding, and to be able to transport casualties. Okay, so ano nga ba yung qualities ng isang first aid provider? Dapat you are calm to take charge. Okay? Kalmado ka lang dapat. And then, you are confident and willing to offer assistance whenever necessary. And patience. Okay. So, bilang isang first aid, dapat natin i-consider bago tayo magbigay ng pangunang lunas, consider natin yung sarili natin. Dapat protected tayo from injury and infection. Kasi nga tayo yung magbibigay ng first aid. And then next, your masks and gloves or wash hands to prevent cross-infection. What is cross-infection? This is transmitting germs to a casualty or contracting an infection to yourself. Or pwedeng ikaw, carrier ka ng virus, mahahawaan mo yung bibigyan mo ng first aid, or vice versa. Si victim natin, baka meron siyang virus na dala na pwedeng mapunta sa atin. Okay? And make sure, as a first aid provider, make sure na ang surroundings mo ay safe. But if the scene is dangerous, okay, you stay away and you call for help. Do not become a victim yourself. Okay, so okay ka na, na-protect mo na yung sarili mo from injury and infection, nakapagsuot ka na ng mask, nakapag-wash ka na ng hands, and then na-ensure mo na yung surroundings mo ay safe. Now, you check for the victim. Baka meron siyang bleeding, or meron siyang open and closed fracture, or deformities, or responsiveness, kung conscious ba siya or unconscious. So, tatanungin natin later, are you okay? Okay ka ba? Hello? Hi? Are you alright? So, kung hindi siya nag-response, then merong something na nangyari sa kanya na kailangan mong magbigay ng first aid. So, aside from that, part of checking the scene, dapat tingnan natin kung may mga iba pang victims para alam natin magtawag kung kinakailangan. Magtawag ng ibang first aiders or medical support kung kinakailangan. And then, you look for any clues that may help you determine what happened and what first aid may be needed. Next, you look for bystanders who may be able to help first aid or go to a telephone to call EMS or emergency medical support or any emergency hotlines. Example is emergency 117. Sa US naman is 911. Sa atin naman pero, kung ano yung nearest na pwede nating tawagin, pwedeng RHU, pwedeng sa police station, pwedeng sa Bureau of Fire, or yung mga malapit na clinic sa atin, or even doctors, kung may contact tayo sa mga doctors na pwede nating tawagin to help us na occurring emergency. Okay, next. So, yung 6 basic steps in an emergency. Number 1, kailangan natin i-recognize yung emergency. May emergency ba nangyayari? Kailangan ba tayong magbigay ng first aid? And then, you also check the scene if it is safe or not. And then, you check also the victim. Baka may mga bali siya or may mga bleeding siya. And then, itawag po natin ito sa emergency hotlines or the EMS or emergency medical support. And then, magbigay po tayo ng first aid. Yung first aid na bibigay po natin is dapat nararapat doon sa kung ano ang nangyari doon sa biktima or doon sa patient. And then, let us seek for medical attention. Okay. According to Bobby Sherman, you take some time to learn the first aid and CPR because it saves lives and it works. That's why ang next topic natin is cardiopulmonary resuscitation, or also known as CPR. So ano nga ba ang cardiopulmonary resuscitation? Okay, it is a life-saving technique useful in many emergencies, including heart attack or near drowning, pagkalunod, or in which someone's breathing or heartbeat has stopped. Because when the heart stops, every seconds counts. So pag nangyari yan, we should apply immediate CPR because CPR can double or triple chances of survival. So what is or why is CPR important? Mahalaga ang CPR. Because keeping the blood flow active, even partially, will extend the opportunity for a successful resuscitation once trained medical staff on site. Okay? So, ang chain of command, chain of survival is the early assessment, the early CPR, early defibrillation, and early advanced care. Because a strong chain of survival can improve chances of survival and recovery in case of arrest. Ano mga primary assessment na kailangan nating malaman pag magkakandak tayo ng CPR? Andiyan yung doctors A, B, C. So what do you mean by DRS, A, B, C? Danger. You look around if the area is safe. And then R stands for response. Okay, you shake the victim and check the responsiveness. Baka kasi tulog lang siya, lasing lang siya, sa sobrang pagkalasing na nakatulog lang, akala mo emergency, di ba? Okay, the next S stands for you shout for help or you seek for assistance. And the next is to check the airway. You look the airway if there are obstructions. Baka kasi na-choke siya, nakakain siya ng kung ano dyan, tapos yun yung dumara sa kanyang, nag-cause sa kanya ng hindi niya paghinga, kaya nawalan siya ng malay. And the next, breathing. You look, listen, and feel. Okay? And then you call the emergency hotline. And then the last one is circulation, the flow of the blood to run the body. Now, if the victim shows negative breathing and negative pulse, then let's conduct CPR. So, paano nga bang pag-conduct ng CPR? Here are the steps. Number 1, push hard, push fast. So, place your hands on the top of the other in the middle of the chest and use your body weight to help you administer compressions that are at least 2 inches deep and delivered at a rate of at least 100 compressions per minute. Okay, so as shown in the picture, kailangan nating i-locate kung saan yung middle ng kanyang chest, and then doon natin lalapat yung hands natin, and then let us do the compression for at least 2 inches deep and a rate of at least 100 compressions per minute. Okay, step 2, deliver rescue breaths. So with the person's head tilt back slightly and the chin lifted, pinch the nose shut and place your mouth over the person's mouth to make a complete seal. Then blow into the person's mouth to make the chest rise. Deliver 2 rescue breath and then you continue compressions. Okay, so ito yung cycle natin. 30:2. What is 30:2? 30 compressions to 2 breaths ng 5 cycles. So yung 30:2 isang cycle na yun. So ang gagawin natin is 5 cycles. Okay, now if you do the second cycle and yung chest niya is hindi pa rin siya nag-rise with the second breath, then maybe the person choke. Okay, kung paano yun, yung open mouth, and then you look for any obstructions. And then, kung meron man, pa-side view natin, and then, tsaka natin naka-open yung mouth, naka-side view, and then yung dukutin natin kung ano man yung nakaharang. Basta, kaya lang kamay natin. Alright? Then, next, you continue CPR steps. Kung wala pa rin talaga, you continue performing the cycles of chest compressions and breathing until the person exhibits signs of life, such as breathing or an AED becomes available or EMS or a trained medical responder arrives on scene. Now, take note. You end the cycle if the scene becomes unsafe or you cannot continue performing CPR due to exhaustion. Baka kasi pagod ka ng compression, nagkakandak ng or nag-perform ng CPR, pwede mo na siyang stop kung napagod ka na. At least you did your best na tumulong. Okay, paano naman ngayon, ma'am? Dahil pandemic po tayo. Sabi ng IATF, social distancing, no close contact. Kasi hindi natin alam kung sino yung carrier. Baka ko yung carrier ng COVID-19 virus, or ikaw yung carrier, or yung patient yung carrier ng COVID. So, paano yun, ma'am? Paano tayo magsi-CPR? Tuloy pa rin po ba ang CPR noon? Alright, yes, tuloy pa rin ang CPR, pero medyo baguhin natin yung procedure. Alright? So, same pa rin tayo doon sa someone of the step 1, push hard, push fast, and then you call for help. And the next is, before you do the CPR itself, you need to cover towel doon sa mouth niya, kasi cover the nose. Kasi sabi ko nga, hindi natin alam kung ikaw mismo na responder yung carrier or yung victim yung carrier ng virus. So, i-cover natin. Let's protect each one sa ating virus. Okay, next. Do not do mouth to mouth. Yung kanina, merong pinch nose, head tilt, pinch nose, close your mouth to mouth. Ngayon naman, bawal. Alright? Then, ano yung gagawin natin? You start chest compressions to the tempo of staying alive. Alam niyo yung staying alive? Ito, oh. Okay. Yun yung tempo ng ating chest compression kanina. So, sasakto siya sa 100 to 120 chest compressions in a minute. Okay. Ito, panoorin nyo itong video clip regarding sa steps how to conduct CPR.
CPR o cardiopulmonary resuscitation. Ito ay paraan ng pagbibigay ng tuloy-tuloy na supply ng dugo sa utak sa pamamagitan ng manual na pag-compress sa bibig ng tao na nawala ng malay at maaalay himpuan ng tibok ng puso. Ang Philippine Red Cross na isa sa mga non-profit organization na may responde sa una ang magtutulong sa dito.
So, paano natin ginagawa ang CPR? So, sa una, ang gagawin natin dyan is titingnan natin kung yung na ating tutulungan ay talagang tumigil yung pagtibok ng puso. Bago tayo pumunta sa isang tao na tutulungan natin, check muna natin yung safety ng lugar. Sa paglapit natin, ang una nating titingnan ay kung meron bang malay yung tao. So, paano natin ito-check yun? So, gawin natin yung pagtapik sa balikat at pagtatanong kung yung tao ba ay naririnig ka o di ka naman ay kung meron siyang reaksyon.
Kung walang reaksyon galing sa tao, tumawag ng tulong mula sa emergency local numbers gaya ng Philippine Red Cross Hotline 143.
Ngayon, kapag nakatawag na po tayo ng tulong, tingnan na natin kung meron pang tinatawag na signs of life yung tao. So, paano natin gagawin yan? Una, itilt natin o ititingala natin yung tao. Sunod, ipuposisyon natin yung ulo natin ng halos nasa 2 pulgada lamang ang layo ng ating pisngi mula sa bibig ng pasyente. At titingnan natin yung dibdib ng pasyente. Kapag nagawa natin to, pwede tayong bumilang ng 10 segundo.
Kung hindi humihinga, pwede nang magsirawa ng CPR. Bilang proteksyon sa posibleng nakakahawang sakit ng taong tinutulungan, mainam na gumamit ng face shield bago simulan ang CPR.
So una po, ilagay natin ang ating palad, yung heel ng palm, yun dapat yung nakalapat dun sa center ng chest ng pasyente na tutulungan natin. So naka-interlace ang ating mga fingers at nakalock ang elbow, tuwid ang braso, at ang ating bigat ay nasa ibabaw ng pasyente. So pag naposisyon na po tayo ng ganito, pwede na po tayo magsimula ng compression. So pagkatapos ng 30 chest compression, saka natin ititingala ang pasyente, ipisilin ng ilong at magbibigay tayo ng ventilation. So 2 beses po natin i-ventilate yung tao bago magpatuloy dun sa ating compression. So uulitin po natin ito ng 5 beses. Yung nakita po ninyo na 30 compressions and 2 ventilations, yun po ang standard na 1 cycle ng CPR. Sa loob ng 2 minuto, gagawin po natin yun ng 5 beses.
Pagkatapos ng 5 cycles ng CPR, tingnan ulit kung meron ng signs of life ang tao. Kung hindi pa rin ito gumagalaw at wala pang paghinga sa loob ng 10 segundo, uulitin ang CPR.
Kung sakali naman na ang pagbibigyan natin ng CPR ay isang sanggol, ang gagawin po natin dyan ay halos parte din dun sa pagkamatanda. O pwede po tayong humingi ng pahintulot mula dun sa kanyang mga magulang na tayo ay tutulong sa kanya. At ang una po natin ulit na titingnan ay kung may malay ba. So ang gagawin natin, mag-stimulate natin yung bata. So tingnan natin kung nakikiliti ba, may paggalaw ba.
Kung hindi ito gumalaw, dapat nang tumawag sa local emergency numbers.
Titingnan natin ngayon kung merong signs of life yung sanggol. Humihinga pa siya o gumagalaw. So gagawin natin ito sa pamamagitan ng tinatawag natin na LLF position or look, listen, and feel position. So katulad nung sa matanda, ang pisngi natin dapat ay nakatapat sa bibig at ilong ng sanggol sa layo lamang na halos sa 2 pulgada at natingin tayo sa dibdib para makita natin kung tumataas pa ba ito para masabi natin kung humihigang pa o hindi yung sanggol. So gagawin natin ito sa loob ng 10 segundo.
Kung hindi ito nagpakita ng signs of life, maaari nang simulan ng CPR. Tanging 2 daliri lang ang ilalapat sa dibdib ng bata.
So pwede pang 2 daliri yung nakalapat sa dibdib ng sanggol habang yung isang kamay po natin ay nakasuporta sa ulo. So habang nagsi-CPR po tayo, again, 30 compressions, 2 ventilations, nakatingin po tayo dapat sa mukha ng sanggol para makita natin kung meron ba itong magiging reaction kung sakaling nagbibigay na tayo ng chest compression. Dahil kung meron po, ibig sabihin po, kailangan natin tumigil doon sa pagbibigay ng CPR.
Dahil sanggol pa lamang ang pasyente, siguraduhin 1 pulgada lang ang lalim ng compression. Pagkatapos ng 30 chest compressions, isunod ang ventilation.
So yung 2 ventilation po ngayon, bagya po natin na ipapantay yung ulo ng pasyente. So dapat po yan ay nasa neutral position o halos pantay yung mukha ng pasyente. Tapos saka tayo magbibigay ngayon ng ventilation. So yung ventilation po na gagawin natin yung tinatawag natin na mouth to nose. So sakop ng bibig natin yung ilong at bibig ng pasyente at magbibigay tayo ng hininga doon sa sanggol.
Upang maiwasan ang komplikasyon, dapat sapat ng ang hangin na binibigay sa sanggol. Matapos ang isang cycle, ulit-ulitin lamang ito para makabuo ng 5 cycles of CPR sa loob ng 2 minuto. Pagkatapos ng 2 minuto, obserbahan ang sanggol. Kung wala pa itong signs of life, ituloy ang CPR.
Ilang CPR kung nagkamali ng sanggol. Ang ina na ang pagbibigay ng CPR.
Dahil ang kaligtasan ay magsisimula mismo sa ating mga sarili, Sinubukan ko rin ang CPR. Madali kong titingnan pero nakakapagod pala kung iyong susubukan na pagtanto ko na kailangan talagang ibigay ang buong lakas dahil buhay ang nakasalalay.
Ayan. So, napanood natin kung paano mag-conduct ng CPR sa isang adult at saka sa isang sanggol. Okay, next. So, let's have a recap of what we have discussed a while ago. So, first aid, again, this serves as a bridge between the victim and the doctor or the medical facility for survival. And CPR is a life-changing or life-saving technique useful in many emergencies. So 6 basic steps in an emergency. You recognize the emergency, you check the scene, you check the victim, you give first aid, you call emergency hotlines, and you seek for medical attention. Now, I think you are ready para mag-quiz tayo. Short lang naman ito. Huwag kayong mag-alala. Kayang-kaya nyo ito kung nakinig kayo at kung nag-jot down notes kayo. Okay, so question number 1. What is first aid and why it is important? Pwede kayong gumamit ng notebook ninyo sa ROTC or any pad paper para isulat niyo yung question and then answeran niyo na rin. Okay, question number 2. You write the steps in conducting the traditional CPR and the CPR during the pandemic. So, dalawa yun. You write the steps in conducting the traditional CPR, yung CR na kinakonduct natin pag walang pandemic, and then yung CPR pag merong pandemic. Okay? So, remember again yung sinabi ni Bobby Sherman, you take some time to learn first aid and CPR. So it saves lives and it works. Thank you for listening and always remember the health and safety protocols amidst this COVID-19 pandemic. So see you next meeting.